Good afternoon, everyone, and thank you for joining us today at our media advisory. I want to welcome Dr. Elizabeth Richardson, our Medical Officer of Health, and Paul Johnson, the city's Emergency Operations Center Director. And as you know, we remain under a province-wide state of emergency and stay-at-home order until at least May the 20th. The situation in our city and across the province continues to be very serious, with ICUs continuing to fill up and hospitals pausing non-emergency surgeries to preserve intensive care unit space for COVID-19 patients. Now, I know that stay-at-home order is difficult, but we continue to see a surge in COVID-19 cases, including variants of concern, and these restrictions continue to be required to help reduce the spread of this virus. Under the stay-at-home orders, please remain at home except for essential reasons such as going to the grocery store or pharmacy, accessing healthcare services, including getting vaccinated, exercising outdoors in eligible spaces, and for work that cannot be done remotely. You're asked to remain in your local communities, avoid all non-essential travel, even within the province, and stay at home when you're ill, even with mild symptoms. And with the extension of the stay-at-home order and additional restrictions announced Friday by the province, there are, of course, some impacts to city services, and Paul is going to walk us through those in a few moments. I know that the police and city bylaw will be monitoring and responding to situations where the provincial orders are not being adhered to. And with respect to playgrounds and play structures, for clarity, because there was a change on this over the weekend, playgrounds, play structures are now open and available for use. But please stick with only those who live in your household. Please wear a mask and physical distance at every opportunity and when you're at these playgrounds and on play structures. Before I hand things over to Paul Johnson and Dr. Richardson, I just want to take a moment to recognize that this week is National Volunteer Week. This year's theme, The Value of One, the Power of Many, highlights the importance of our individual actions as well as our collective strength. Over the last year, we've seen many Hamiltonians supporting each other by delivering groceries and meals, medicine to neighbors, driving seniors to appointments, raising money and gathering resources for community need, and the list goes on and on. I want to extend a heartfelt thank you to all of those who are volunteering in our community right now. Your service to our community is greatly appreciated. Thank you to everyone who continues to do their part by following our public health measures. You are making a difference. And please, if you need more information around all the issues around the coronavirus, the vaccine, or lists of restrictions, you can go to the hamilton.ca/coronavirus website. And you can see all the stay-at-home orders that are available to you now, as well as all the resources that are available to you to get through this pandemic. On that note, I'm going to turn it over to Paul Johnson, our Emergency Operations Director, for any updates for city issues and city facilities. Paul.
Thanks very much, Mr. Mayor. I'll start with the two pieces that have changed over the course of the last couple of days. The one that was mentioned by the mayor is that the province closed playgrounds or play structures down, then allowed them to be opened for use. Our crews had been out because we got this information late on Friday. They had been out Saturday signing. We made the decision that further overtime and expending of resources to take the signs down on Sunday made little sense. So they're out there doing that today. Just a reminder though, that while you can use the playground structures, we are still asking you to keep a mask on and keep physically distanced as much as is possible. And really that may go more for the adults, caregivers, parents who are bringing people over. A lot of times there is some socialization that's happening, people sitting on benches together, watching kids play. Just a reminder that if you're not within the same household, you should be keeping that 2 meters distance and you should be wearing a mask at all times. And you can be charged and fined for that behavior if you're not doing it. So we really encourage people to get used to the masks. Many kids are used to it from the school that they're in, and I know schools are out right now, but they're used to it from being in school, and we as adults should all be used to it as well. And there has been a shift to really encourage people to consider mask use almost always when you're outside, except potentially if you're just all by yourself and there's no one around you, then obviously that's a bit of a different story. But there's so many times when we're outside, even walking along, whether it's on paths or trails or obviously at a playground, where we come within 2 meters of other folks, and we want people to be as safe as possible. So consider wearing those masks. We have, as a city, made some changes around encampment stairs today, escarpment stairs today. One of the things we've done is taken down the barricades. They were being removed by individuals in the community anyways. And again, we did not want to have to inspect and change it each day. So you'll see that the escarpment stair entranceways are no longer barricaded. And we are in the process of putting up some signs that will indicate that the stairs remain closed for all recreational and non-essential use. However, the stairs can be used for essential travel only. It's never our intent to block those who need to move around this community for essential reasons from using the stairs. Many people do move around by foot, not by public transit or automobile or bike or other things. And so this will allow those who need to make essential trips, and that would be to essential workplaces, that would be for medical appointments, all of the things that the mayor just talked about. Obviously, our stairs can now be used for that. Masks are mandatory on our stairs. It is very hard for people to maintain that physical distancing, particularly if you have to pass somebody on the stairs. And in some cases, even if you are going in opposite directions up and down the stairs. There will be enforcement on the escarpment stairs, and we will be looking for those who are clearly using them by virtue of their actions, are clearly using them for a recreational purpose. And because they are a closed facility by the city of Hamilton for recreational use, our bylaws allow us to enforce a fine of $500 for people who are violating that. We will not be stopping people and grilling you on why you're using the stairs. This will be observed behavior. And when our officers in the course of that observed behavior and investigation believe that it's being used for recreational use, they will exercise their authority under our existing city bylaws. Important to note, this is an existing city bylaw because the city has closed these for recreational use. When it comes to fields, courts, and skate parks, they're all closed and they will remain closed. And so please find a way to enjoy activities outside of playing baseball, soccer, getting onto the basketball court or tennis courts, pickleball courts, skateboard parks, and our Gage Park pump track. All of those are closed. Find ways to recreate. The parks themselves are open. Walk through the green space, walk across the soccer field, ride bikes, roll, whatever it is that you need to do to keep active. We really want people to keep active. But this is a time where those activities, they may be a bit more boring. This may be about just getting outside and getting moving in some way that makes sense. But again, this is for a few weeks while we make sure that we do our part to lower the possible transmission of COVID-19 in any scenario. And again, lots of commentary that while it's safe to be outside, while it is true, it is lower risk to be outside. But we have observed behavior where people are too close together, not wearing masks, even outside, and that does increase the risk. And the other key piece is that these next few weeks are about us staying at home or staying close to home unless we absolutely need to go out. It is back to what we were trying to do in the early part of this pandemic. We need to do it now because the cases are much higher than we've experienced. And the numbers you're going to hear from Dr. Richardson will reinforce this in spades. So do your part and enjoy our parks for what they are, walking through and all sorts of things. But please, no organized games. Don't get onto those tennis courts and just have a game because you really want to. We'll get back to that as soon as we can. For those who use our transit system, HSR is requesting, and all of us are requesting that you use these for essential trips only and essential travel only. Again, all of us are encouraged not to travel around this community, whether it's by private vehicle or by public transit, unless it is essential to do so. That will ensure that we have the smallest number of people using the buses during this really critical time where variants are circulating within our community, and we are still doing our work to vaccinate as many people as possible. For those who starting today, for those who are attending weddings or funerals, religious services, rites, or ceremonies, just a reminder that as of today, Monday at 12:01, there have been changes to the limits. So now it's a maximum of 10 people who can attend those activities, whether indoors or outdoors. Drive-ins are still permitted, but you must stay in your vehicle. The vehicles must be closed to the elements, and you can get out to use a washroom or other health and safety purposes, but you need to stay in your vehicle for the duration of those activities. And the cars must themselves be distanced by 2 meters as well. We did have a fair amount of enforcement over the last week. Still lots coming in from a residential perspective, which indicates that people still are not recognizing that it is prohibited to have individuals from outside your household attend activities inside your house, except in very limited circumstances. And those circumstances would be if there's another single person who is exclusively partnered with your family, or it's essential work that needs to happen. If your furnace conks out or you need to have essential work done on your house, obviously those types of maintenance things and repair things can occur. But other than that, can't come in. And so some examples of things that led to charges this week, all of these are things that don't fall into that category. We had indoor birthday parties. We had an outdoor birthday party of more than 30 people. We had a baby shower. We had an indoor wedding. We had those getting together to watch a boxing match. And we did as well. And I know that a number of people heard about this through the media and social media, but we did lay charges at the Hugs Over Mask protest that happened in our community on Sunday. So whether these are organized protests and things like happened on Sunday, or whether they are private gatherings, they are prohibited, both indoors and outdoors, except with those limited exceptions. And we will be enforcing as we need to today, tomorrow, and throughout the stay-at-home order, and continuing as we move through the end of this pandemic, regardless of what level we are within the provincial framework, our enforcement folks will be out doing their jobs as well. With that, I'll pass it over to Dr. Richardson.
Thanks very much, Paul. So going to go through some case data as per usual and talk about the vaccines and what's happening on that front. So 15,517 total cases today in Hamilton, up 214 cases from yesterday. We now have 1,782 screen positive variant cases, and we have all of B117 variants detected, as well as P1 and B1351. So all three of those have been detected at this point here in Hamilton. We're sitting at just over 70% now as of this afternoon, cases with a mutation or variant of concern when we look at the cases that have been reported in the last 7 days. So this is very similar to the levels that they've been seeing across the province as a whole. We have 1,400 active cases here in Hamilton, 346 deaths to date, with 2 new deaths having been reported today. A total of 40 outbreaks that are currently going on in Hamilton. And of course, those are all listed on our website. 2 new outbreaks were reported today, one at Friends of Jesus Christ Ministries of Greater Hamilton and Burlington, and one at Hamilton General Hospital on Unit 5S. S as in Sally, not Frank. Hamilton's 7-day moving average number of cases reported per day is now at 175. Our weekly incidence, as I said, is at 205, and our reproductive rate up at 1.28. So more can be found on our dashboard. And as you know, it's now interactive. And so people can dive in to do more connections with the data as they would like to do. From a vaccine rollout perspective, today we have administered 153,551 vaccines, which makes for 27% of the eligible population over the age of 16 that have now received a vaccination. And with our steady but limited supply, we are working with our healthcare partners to carefully and effectively vaccinate the eligible phase 2 population that we're in right now. It's a very large group of people. About 300,000 people in total in our community fall into that group for one reason or another, because it includes those that live in congregate care settings. It includes those with highest high and at-risk medical conditions. It includes our essential workers. It includes a number of different groups in that phase 2 population. And so we do need to move through and vaccinate those and continue to focus on vaccinating first those are at greatest risk. We were very pleased yesterday when we started to hear about the age for eligibility to use AstraZeneca vaccine being lowered here. And so as of Tuesday morning, that age limit will be dropped to 40 years of age, bringing it down from what was 55 earlier. So that is great news. So more people will be able to access that vaccine through pharmacies as well as through primary care. I just want to note again that the booking system for pharmacies is a separate stream. While you can go on the provincial website at covid-19.ontario.ca/vaccine locations, you can go there and find the pharmacy locations that are near you. It is not through that you actually book. You then find the pharmacy and then you book through the pharmacy itself using whatever instructions are there on the website around how to book. In some cases you call and book. In some cases you use a web-based means to book in with those. So it's not run by the province or by Public Health Services, but is run by the pharmacies themselves. We are working together with our primary care partners. You know that they have been doing vaccination with their patient populations, focusing in what we sometimes call our code red neighborhoods. But we're also working with them to set up additional clinics to administer the AstraZeneca vaccine, and we'll have more details on those soon. You know, there is some interesting or some new information that is out there on the Twitterverse about perhaps some delays in AstraZeneca future deliveries, but many of these pharmacies and these sites already have vaccine on hand. So please do continue to go out and seek those vaccines from both primary care and the pharmacies. Just a note again about AstraZeneca, and you know, we often get the questions of which vaccine should I get, and the best vaccine for you to get is the one that you can get. As we go through these eligibility criteria, there will be different criteria that come up, and as soon as you become eligible under one of those criteria for one of the vaccines, that is the vaccine you should go out and get as soon as you possibly can. It really is essential to get those vaccines in arms as quickly as we can, both to protect ourselves as individuals, but also for you to protect your loved ones and to protect your broader community as we're continuing to go through the pandemic. So by dropping the age for AstraZeneca down to 40, of course, we'll be able to offer protection through the vaccine to more Hamiltonians earlier than we had initially anticipated. There are also mobile pop-up vaccination clinics scheduled for this week locally at Shidok Twin Pad Arena, the Salvation Army Mountain Citadel on Stone Church Road East, and Salvation Army Meadowlands on Stone Church Road West in Ancaster. Those will be running today, tomorrow, and Wednesday. These mobile vaccine pop-up clinics are for community members who are in our priority neighborhoods. Those are the ones that have postal codes that begin with L9C, L8W, L8L, L8N, or L9K. And after Wednesday of this week, the teams will be moving on to other locations. So do reach out to get vaccinated at those locations over these next 3 days. The teams will also return to those locations for scheduled second dose appointments. So if you have, you'll get your second dose appointment when you book in, and the teams will be back there to give those second doses. Those who are 50 years of age and over and live in those, the way that you can book into those clinics, you can call the Public Health Services COVID-19 hotline at 905-974-9848, option 7 for an appointment, and just ask to go to the mobile hotspot pop-up clinic. When you get there, proof of address must be shown when you arrive, and to show that you're eligible as a part of those clinics, because we really are focusing on those areas of our community that have been disproportionately affected by COVID-19 over time, and wanting to target as much as possible vaccine to those individuals, and that will help us as well to reduce transmission in the community more broadly. The 3 large-scale vaccine clinics at First Ontario Centre and St. Joe's West 5th Clinic, as well as Hamilton Health Sciences on Wellington Street, continue to vaccinate eligible community members. And we are hopeful as people go out and access all of these different opportunities, you'll continue to see our vaccine coverage climb. In general, for those of you who tuned in today to our Board of Health meeting, you'll know that COVID-19 case activity has surpassed the peak of wave 2 and continues to increase. As I mentioned earlier, the percentage of cases that have screened positive is also growing, and with us now being up at 70%. Our ICUs locally are being overwhelmed, both by people who are getting sick and needing ICU care from our community, but also in support of those around us in Toronto, in Peel, and elsewhere who are experiencing high rates of hospitalization, high rates of severe disease, and people needing to be in ICU and supporting one another across Ontario with that care. We did show some modeling from that looks at what is expected over the coming weeks and months. And you'll see that the peak of wave 3, as the modeling shows right now, is expected to come later this month or early in May. And as this goes forward, we'll continue to update that modeling and see where that may come down to. We do find ourselves at a very difficult time right now. I know there is a lot of challenge with COVID fatigue, and we did see that there were in some communities in Ontario protests that were going on, including some here. And as we look at what's going on, I think I cannot underscore enough just how serious the situation we are in. We're seeing it with the number of cases we have. We're seeing it in terms of the age groups that are being affected. The vaccination program in those who are older and in those in long-term care and retirement homes has worked, but it means that the transmission that's continuing to go on is happening in our younger age groups. And with this being a more infectious variant, it is spreading faster and faster and affecting more and more people. We are seeing those people who are affected increasingly end up in our hospitals, increasingly end up in our ICUs, and it's very, very worrisome. When we've gotten to the state where we're relying on our colleagues across the country to come and help us in our ICUs because we do not have people to support, even if we open up more beds, those in ICUs. We do not have the staff to support those individuals. It shows just how serious a situation we are in. And so very much encouraging people to continue to follow public health measures. It is those that will bring those numbers down. And by this, I mean staying home, just as you've heard from the Mayor and Paul already, staying home except for the most essential reasons to go outside, to go to work, to exercise, to get food, to go and seek medical care. As Dr. Yaffe said last week during her presentation at the provincial tables, really what we want to see is that return to the streets looking like what they looked like last April. And I can recall just leaving from conferences like this one that we held at that time within City Hall, just how empty those streets were. And while we do want you to go out and get the kind of boring exercise that Paul has just talked about, it is critical that people reduce their mobility, reduce the amount of contacts they're having, ensure that whenever you're outside and anywhere near others that you are wearing that mask and not going out at all if you're sick. So with that, I'll turn it back to you, Mr. Mayor.
Thank you very much, Doctor and Paul, for your information and, acknowledging that this is hard and tough for all of us to work our way through. We need to be up to the challenge. I don't think we have much choice in that matter. And so all the anxiety or fear or worry that's out there needs to be turned into action. And as one medical officer of health or one medical person said, that it's believed that our healthcare system is our first line of defense. It's actually the last line of defense. You are the first line of defense. You are the ones that are going to prevent these cases from happening by the actions you take in our community. So I encourage you to follow the public health recommendations as much as you can, as often as you can, and as much as you have to date. And this is no time to give up on those measures. As you heard today, the province has announced it has expanded the age eligibility of the AstraZeneca COVID-19 vaccine to those 40 plus. I encourage you to get that vaccine if you're eligible in that age category. It's an effective prevention tool to protect the health of you or your loved ones and our community. So it's vital that we all, including those that have already been vaccinated, to continue to follow the public health guidelines to reduce the spread of COVID-19. The best community service you can do for your family, your friends, your neighbors, your community service is when you're eligible, get vaccinated. So on that, I'm going to turn it over to Jasmine for some media questions. Jasmine?
Thank you, Mr. Mayor. We have 5 media joining us today. Start with 1 question and 1 follow-up for everybody. The first question will be to Nicole Martin from CHCH. Nicole, you can go ahead.
Hello and happy Monday, everyone. My first question's for Paul. It's about the escarpment stairs. So we were out at a few locations today, lots of people exercising still, no signs, barriers down. I just want to know, how many bylaw officers are you assigning to each set of stairs? How will they actually be checking that you're going for an essential trip? Because there's a lot of people who wear workout gear to go to the grocery store, go to work. So I'm just wondering how bylaw will go about doing this.
So first, we're not assigning special people to it. It's going to be part of the proactive rotation. We have so few bylaw officers. I think people feel that we can just keep assigning them to all the things that we're enforcing. And the answer is we add it to the mix. So it will be done on a proactive basis as well as a reactive basis. I understand that today it's a challenge. We're doing up the signs. We had to remove the barriers because they had all been broken through anyways. So I'm sure it's a little bit of a free for all today, but the signs will be up very soon. And our bylaw folks are getting there. And I think the important piece is they're going to observe what's happening. And regardless of what you're wearing, if you're making your way one way down the stairs and then continuing on with your path, then you're really not exercising. It might have been one, but we'll let that one go, regardless of what you're wearing, because we do know people sometimes wear workout gear to get to work and then change at work. What we're looking for is the people that are going repeatedly up and down. You obviously wouldn't be doing that as an essential travel piece if you're going up and down the stairs several times. And that is a lot of what the recreation is, either partially going up and partially coming down or going all the way up and all the way down several times. And I know I struggle to do it more than once, but lots of people are much fitter than I am and they can. That would be a recreational use. So it's going to be that way. The point here was that we heard a lot that people use these for essential travel. And the statement I would like to make is, if you don't need it for essential travel, don't try and find a way through it that says, well, hey, if I do this or don't do this, or will they catch me? When are they doing it? That's not what we're after. I'm asking the community to not use the stairs for recreational purposes. Our EOC talked about this at length Friday and over the weekend. We debated it, we looked at it, and the consensus of the Emergency Operations Center is that we did not want to penalize those who do use this as a way that they get to work or get to essential appointments. But we knew that this is what would happen. Initially, all these questions would come in. Wow, hey, how are you going to do it? And when people see somebody, they'll expect that there's an officer right there ready to jump into action. And the reality is, like everything else that we have to go after, we won't have enough people to cover it all times and all of the stairs. But you are taking a risk if you continue to use it as a prohibited use. You take the risk of being assessed a fine of $500. And really what I'm appealing to is, I hope we don't have to give out any fines. I hope very few people are up and down those, because that means it's only the people that are using it for essential travel. Don't impact and don't put at risk those who do use it for essential travel. And the final piece is, of course, all folks, including those for essential travel, must be wearing a mask when they're on the stairs. So this will go into the regular rotation of all of our bylaw officers. So they could be there at any time. They could be at any set of stairs at any time. And that's the randomness also, which will help the community to recognize that they'll have to think twice about using it for some of those other uses. So I recognize today, with the sun out, temperature in a not bad range, I'm sure there's been lots of recreational use. It is not prohibited. The signs will be quickly up saying it's prohibited and closed for those activities. Let's keep it clear for those essential trips that people need to make. And as I say, we expect that in just a number of weeks' time, we'll be back to having those stairs available for people to press their best time and try and do it once, twice, 3, 4 times, whatever it is, so they can get their fitness level up. We'll be back to those types of activities, but the time for that is not now.
Thank you, Paul. I did have a chance to speak with a lot of people who were using it today, and there's been a lot of pushback, many saying, like, how does this follow the science? Some doctors have shared studies from Ireland, for example, where outdoor transmission's like 0.1%. So I guess this next question is for Dr. Richardson. I'm just wondering how many COVID-19 cases in the city of Hamilton have come directly from the escarpment stairs?
Thanks, Nicole. When we do the work to investigate our cases and figure out where the cases come from, our staff do an incredible job of working with the people to help understand where transmission may have occurred for them. And that's so we can both understand more broadly what is happening around transmission in our community, but also for that individual to understand, and so we can make contacts or contact with their contacts and let them know that they may be at risk so that they can quarantine and take those steps to reduce transmission. So when people are going about their day, we don't always identify exactly where it is that people got COVID-19. About 30% of cases, we don't know. People aren't aware of somebody who they may have been in contact with that was sick. They don't recall doing something where they were in proximity to others for any period of time with their mask off. And so we just aren't aware. And it is that kind of transmission. One of my colleagues in one of the media briefings I've heard over the past week or so has talked about that piece about how with this particular variant of concern, with the fact that it is more transmissible, the things that we did that we managed to get away with during the first wave or two that were didn't cause transmission, those are unfortunately becoming more likely to cause transmission now. And we know just overall, as Paul has said and others have said, what we're trying to do is bring down mobility so we reduce those incidental contacts that don't need to happen. Those times when we take our mask off and didn't realize we were right close to somebody else, or just, we're just not used to it because we have been indoors so much. Whatever the reason is, that we have those small breaks of transmission or small breaks in infection control practices that lead to transmission that we're trying to prevent. And so that is what is being focused on right now with the stay-at-home order, with the various closures that we're seeing, so that we can reduce that risk of transmission overall.
Thanks, Dr. Richardson. Next question is to Samantha Craigs from CBC Hamilton. Samantha, welcome back, and you can go ahead.
Thank you. My first one is for Dr. Richardson. I've talked to some people who have some consternation in terms of the amount of time that passes from the first shot to the second one. And I'm wondering if you have heard of anyone who has had the first shot and then gotten sick from COVID enough to require some form of medical attention, or if not that specific example, have you seen anything locally that would challenge the efficacy of that lag between the first shot and the second one?
Thanks, Sam. It's, as you know, the decision to delay out that second dose is one that was made on the recommendation of the National Advisory Committee on Immunization, a group of learned colleagues who look at these issues, look at vaccine efficacy, and make recommendations. And what we're very much trying to do is improve the number of people who can get vaccinated and get coverage from that single shot during this period of time, and then look at bringing up immunity levels with the second shot even further after we get through as many people as possible with that first dose. So in looking at the evidence, they are seeing with all of the vaccines that are currently offered in Canada that we can push off the timing of that first vaccine with very little impact on overall immunity that is developed from those vaccines. That makes sense based on what we're seeing. It makes sense based on what we know of vaccines generally and principles of immunology that would be the case. And in fact, in some cases, pushing the second dose off further actually results in even better long-term immunity than having it earlier on. And so those are the principles on which it's based. That said, none of the vaccines are perfect, and there are certain groups for whom their immune systems just aren't functioning well enough to put that second dose off. So there's a subgroup of people for whom they stay on product monograph, as we say, on the original dosing schedule to get that second dose. You've seen that in long-term care homes and retirement homes, and you see that with certain other medical conditions that are at risk. Every vaccine, though, is not 100% perfect in terms of its coverage. So we will see cases that occur in people who have seen a single dose of vaccine, either because they've already been exposed to COVID and were getting sick, or exposed in those first couple of weeks, during which time your body's starting to build up immunity to the vaccine, or because for whatever reason, they haven't had a response to the vaccine. So they will happen. We are part of the broader what we call monitoring system, if you will, in terms of the vaccine, to see how it's working. And so we do collect data on all of our cases in terms of their vaccination status, and that is used on a provincial and national basis to look at whether there are any patterns in terms of people getting sick, even though they have been vaccinated. And certainly we look, if we see anything that looks like it might be something in common, we look at that, and we haven't seen anything that shows a pattern really around cases that are happening. And we do look forward to seeing those continued analyses at a larger scale at the provincial and federal level.
Thank you. My next question is to Mr. Mayor. So you heard from Dr. Sider today that we actually could have COVID case numbers that would put us in the gray zone until the end of June. How will you keep people on board for that long?
Thank you, Sam. And, it's a particular challenge. Obviously what we want to make sure we do is we share the most accurate information we have with our citizens as quickly as we have it, to let them and help them make informed decisions. The best we can do is give them what needs to occur and how we can prevent further spread and how we can get those case numbers down. And the challenge is, and I think what we're seeing currently is we're seeing a lot of pushback on a lot of the areas that would allow us to actually constrain mobility and potential spread in our community. We're hearing that not only in the broader community, we're hearing that politically and otherwise. People are fatigued on a lot of these measures, but at the same time, I think people need to understand that these measures are the one aspect of our getting out of this pandemic is, yes, vaccinations, and we encourage everyone to get vaccinated, but also continuing to take hold of the physical separation issues and the lockdown measures, the stay-at-home measures, which, it's a bit of an oxymoron to tell people to stay at home and at the same time open up a whole range of different things out there that they can get to. It really doesn't, in my view, meet the objective of eliminating the spread as much as humanly possible. So to answer your question, Sam, I would say it's our responsibility, Dr. Elizabeth, Paul, and others, to make sure that we share accurate information with people in terms of what's happening in our broader community, what's happening in our healthcare system, the impacts of not physically separating and not avoiding one another, and how that is going to impact our future and how long that is going to prolong things if we don't continue to adhere to them in a very concerted way. So I'm committed to making sure that we are factual, truthful, transparent with our community. Then we need to rely on them to make their best decisions to ensure that we get to our stated goal, which is to get 75 to 85% immunity in our broader community. And to be able to get there, we need to continue to have people stay safe.
Thank you.
You're welcome.
Thank you, Mr. Mayor. Our next question will be to Maria from the Hamilton Spectator. Maria, you can go ahead.
Hi, thanks very much. I wanted to ask Dr. Richardson. I noticed on the city's website that some new groups have been mentioned as eligible for being vaccinated, including residents of congregate care settings and community living. So I was wondering if you can just speak to the rollout in those settings and how clinics are being set up for that population and how residents can book.
Thanks, Maria. So for congregate settings, so these are settings that where people, again, are living together. They have shared meals. That's the sort of premises that we're talking about. And so remember, these are for people with developmental challenges. They are other types of RCFs, for example, residential care facilities, shelters as well would fall into this group. So for people in those settings, we're working directly with those facilities, those organizations, to sort out how best to get access to the vaccine. So for some people, they may be able to come to a clinic and be vaccinated there. For others, we need to take the vaccine to them and vaccinate them on site. So that's being worked out directly with those settings and tailored to the needs of those groups.
Thank you so much. And I wonder if you can just mention if there's any settings so far that have already had their residents vaccinated, or is that all pending?
So there are some senior settings that have had that done already. We have, of course, held earlier vaccine clinics for our shelter populations. That happened much earlier because of concerns with the degree of spread that was happening at the time. We've also, of course, gone ahead with our detention center with vaccinations for those who live there. That's actually a congregate setting as well. So those are examples of ones that we've done, and then we've got several more yet to do.
Thanks, Dr. Richardson. Our next question is to Bobby from CBC Hamilton. Bobby, you can go ahead.
Thank you. I hope everyone had a good weekend. My first question is for Dr. Richardson. On Friday, I saw data that I believe was from Public Health that showed if we move to remote learning, we would prevent 637 COVID-19 cases. I'm not sure if that's still an up-to-date figure, but could you just explain how we got to that figure?
Sure, Bobby, thanks for that. So you'll have seen today at the Board of Health that we were presenting about our scars and forecasting and where we're at with several control measures that have been put in place. And you'll have seen at a prior media briefing where Dr. Sider had been through the scars and forecasting and what it is that we were looking at doing with it. And so what it allows us to do is to look at potential different things that are happening today. So basing it on our own experience here in Hamilton, but then looking at what might different interventions do in terms of bringing down the case rates sooner or you know, whether that's vaccine, whether that's through different mechanisms. And the stay-at-home order, of course, as we've been talking about now for a good month or so, is really the most important, most impactful that we saw in wave 2, as well as seeing in now in wave 3. It's the one we're expecting will be the most impactful, and we really need everybody to stick by. So in terms of looking at different scenarios, those numbers would no longer be relevant because time has passed and things have continued forward. And of course, we've had other control measures that have been brought in through the lockdowns and now the stay-at-home order in terms of making a difference. And so it is really those that are most impactful. When we look and do those projections, it's important to remember that those aren't just about what happens in a given setting. That is what might happen in the entire community. And so while any one of those interventions might have some impact, the greatest impact, as I've said, that we're expecting to see is from the stay-at-home order.
And my follow-up question, I guess this would also be for you, Dr. Richardson. I'm just seeing that in a letter to, I guess, post-grad medical students last week, McMaster was saying that some of those students in residency might actually be going to help Hamilton ICUs, and they were also discussing triaging patients before critical care. Is that stuff happening in Hamilton right now? Those sound like pretty intense measures.
Yeah, thanks, Bobby. They certainly are pretty intense measures that we're experiencing. And you'll see, you know, we've talked about today at the Board of Health today again here about the fact that it is our health human resources that are in the shortest supply right now, that as much as we may be able to get beds, we may be able to get space, we may be able to get ventilators, we don't have the people who are trained and have been doing this work. We don't have extra numbers of those people just waiting to come to work. And so there are a number of measures that are being taken across Ontario to look at how they can support people who do end up in those ICU beds. They're looking at bringing in people from across the country. They're looking at different models of providing care through having the experts lead other teams and every other solution that they can possibly think of to help support people who may end up in ICU. So I'm not surprised. I haven't seen the memo that you're speaking about, but I'm not at all surprised by it. This is all part of our healthcare partners' efforts that they're making to have the best resources we can available for the people that will end up in ICU.
Thank you.
Thanks, Dr. Richardson. Our next question is to Joanna from the Hamilton Spectator. Joanna, you can go ahead.
Hi, thanks so much for taking my questions. My first question is for Dr. Richardson. The projections at the Board of Health today predicted that there would be 170 to 180 cases a day at the peak, but we have already hit that mark as we're at 175, average today. So what does that mean for the projections, and what can we expect now at the peak? Where does that put us in with those projections?
Thanks, Joanna. I'm just going to go back and take a quick look at that graph, because my understanding is that peak actually sat at somewhere more like 170 to 230 cases per day. And so if you look at, I think what you were referring to was the gray line, which is sort of the best sort of modeling line that is there based on it. But the range is anywhere from 150 to, as I said, the 230 cases per day. And so it's that range that that Scarson is forecasting, depending on just how good the vaccine uptake is, depending on just how well people follow the public health measures that we're talking about. And so yes, indeed, as we're seeing today, we're at least tracking along that sort of scenario in terms of how we go forward. And that's why it is absolutely critical. You know, we know that we lag behind by about 10 days, 7 to 10 days, perhaps a little longer in terms of the impacts we see in cases. And then of course, the following impacts in ICUs and hospitalizations. And so it is absolutely critical that people are taking this very seriously and making changes in their behavior.
Thanks so much. And my second question, I think, would also be to you, Dr. Richardson. Today at Board of Health, there was talk about a primary care clinic at First Ontario that was discussed, and that would be for age 40 plus. And I also haven't heard much said about the 18 plus in the high risk neighborhoods. So can you talk about both that clinic and also when the 18 pluses in the high risk neighborhoods can expect to get vaccinated?
For sure, Joanna. So first on the primary care piece, that's just the planning for that is just being finalized. So I can't give you further details other than to say we're working on it and we'll get them out to you as soon as we can. On the 18 plus in the priority neighborhoods, you'll know in Toronto and Peel, that's the approach that they've been taking there. We've been working through the 50 plus group. And we'll be looking at making adjustments in our program over the coming days. Again, pieces that we're very much in the midst of looking at the data, seeing where we're at. We've seen some of those areas have very good coverage rates now in their older populations, but maybe not yet in that 50 plus group. And so we're continuing to work at that and decide how to best target those vaccinations in those priority neighborhoods.
Thank you, Dr. Richardson. Mr. Mayor, that's the end of our media questions for today, so I'll pass things back to you.
Thank you very much, Jasmine, and thank you to all of our media partners out there that are sharing this important information with our broader community. Much appreciated. And of course, Bill Custers and the entire team at Cable 14 and Clear Cable that help us put together these media advisories each and every week. Much appreciated. It's been better part of more than a year now, and hopefully that somewhere down the road we will not have to do these media advisories, but I think they're important to continue to share, I think, critical information with the broader community to let them know what is happening in our community and what needs to be done to contain what is a virus that continues to plague us and challenge us going forward. You know, I hear lots of people expressing anger and frustration directed at maybe some of the leadership or those that are making these decisions. And I would recommend that you be angry at the virus. That is really the main source of our challenges and problems. And we are doing everything we can to manage and control and protect individuals in our home, in our homes and in our community. And the stay-at-home order is exactly what it's intended to be, which is stay at home as much as possible. Going out to different locations just increases the opportunity for you to come into contact with this virus and potentially spread it to others. So please be mindful of that and make informed and well thought out choices about what you can and should not do in our broader community. And hopefully in the months to come, we can get this issue behind us as vaccinations continue to increase. Continue to connect with your loved ones through virtual or video chats and over the phone. Check in on your neighbors, especially the elderly neighbors that might be living alone, and make sure they're doing okay and have everything they need. And if you can, as much as possible, shop local through your BIAs or through the hometownhub.ca to connect with and support our amazing business community. Curbside pickup is still very much available, and I'm sure they're all eager and anxious to hear from you to ensure that you continue to get what you need in your everyday lives. As for more information on COVID-19, continue to go to our hamilton.ca/coronavirus website. Lots of information there on all the variables around what's going on in our community, including vaccines, where it's available, who is eligible and who is not eligible. I know it's relatively easy to manage your way through, but if you're in doubt, you can always call the hotline. And I don't have the number in front of me here, but certainly encourage you to do so if you need help and assistance booking or anything else in terms of getting the vaccine. Please continue to follow the public health guidelines, help stop the spread of this virus. It's critically important still and will be until such time as we get 75 to 80% of our population vaccinated. In the meantime, continue to stay safe, help one another, be kind to one another, exercise patience, and we will see you on Monday, April the 26th at 3 p.m. for another media update. Thank you and continued good work.